Good morning. My name is Dr. Georgia Eade. I'm a psychiatrist practicing in Massachusetts. Thank you all for your time and expertise to these important questions, for dedicating your time. I'm here because I share your conviction that a healthy body and mind begin first and foremost with a healthy diet. It doesn't make sense to me that 1 in 6 Americans should need psychiatric medication. I specialize in nutritional psychiatry so that I can focus on addressing root causes of mental illness rather than simply controlling symptoms with drugs. Most neuropsychiatric conditions share many root cause mechanisms: nutrient deficiencies, inflammation and oxidation, imbalances in hormone and neurotransmitters driven by unstable blood sugar and insulin levels, and cerebral glucose hypometabolism, that's sluggish brain glucose processing, strongly correlated with insulin resistance and a key feature of Alzheimer's, now often referred to as type 3 diabetes. My strategy for optimizing brain health is straightforward. I focus on getting people to eat foods that best deliver essential nutrients to the brain and exclude foods that place the brain at risk. I'd love to point them proudly to our guidelines, but how can I do that when our guidelines explicitly recommend refined grains, refined carbohydrates, powerful promoters of inflammation, oxidation, and insulin resistance, all root causes of brain dysfunction? When our guidelines explicitly recommend industrially produced seed oils, which tilt our systems too far towards inflammation? When our guidelines explicitly warn against the consumption of red meat, grounded almost exclusively in epidemiologically based hypotheses about potential health risks that aren't supported by anthropology, physiology, or human clinical trials. The science is clear that including animal foods is the most reliable way to obtain most micronutrients in their most bioavailable form, including some which are difficult or even impossible to obtain from plant foods. When our guidelines recommend we base our diets on grains and legumes, starchy staples which are low in nutrients and less fortified, high in anti-nutrients, and too high in carbohydrate to be safe for the growing majority of us with insulin resistance. So instead, I recommend a whole foods pre-agricultural diet as a starting point, or in cases of compromised brain glucose metabolism, a ketogenic diet. These work very well in clinical practice. The current guidelines cause my patients' families and healthcare teams to worry that that same diet, which is helping their ADHD, bipolar disorder, chronic anxiety, or early Alzheimer's, is somehow dangerous. I don't envy you your task. The nutrition literature is vast. It's heavily influenced by politics, money, and the strong personal feelings we all have about food. However, I sincerely hope that you will stay intellectually curious, ask fresh questions, challenge assumptions, and acknowledge the limitations of the science rather than presenting it as settled, to allow clinicians and patients the freedom to discover what works best for them within their dietary pattern of choice. Thank you for your work and best of luck. We're all counting on you.
Be sure to hit that subscribe button for more highlights and information about the changing dietary guidelines in 2020 and exclusive analysis you won't find anywhere else on YouTube. And make sure to hit that notification bell too, so you don't miss the next video. Y'all know what time it is. Red Pill Vegan. Next.